Hi, good morning. I'm Gian Busetto. I'm coming from Italy. I'm a consultant urologist. Since I reached my PhD in andrology, and my actual work is at Sapienza Rome University. I'm a researcher, and I am an adjunct professor. Erectile dysfunction after premature ejaculation is the second most common andrological disease. Taking in consideration the age between 40 and 70 years old, we have up to 50% of people suffering from erectile dysfunction. This is why it's really important to take care about this disease. To understand the physiopathology of the erectile dysfunction is not easy because it is a vascular problem and is related to so many factors. And this is why even releasing therapies is not easy. To date, the first-line treatment for the erectile dysfunction is the PDE5 inhibitors, and the second-line therapies is the intracavernosal injection with prostaglandin or vacuum device. In most difficult cases, we have only the chance of an implant of a penile prosthesis.
Regarding the male infertility, how far the sperm count matters?
It's really an interesting topic because, like till 20 years ago, there was still no interest in the male infertility because the infertility was considered just a problem of the women. So nowadays we changed completely our mind and we understood that up to 50% of infertility depends on the male factor. This is why the sperm is something that really counts. And maybe in the future we can even consider the sperm quality as a mirror of the health of the person. So this is just in the future.
How can we improve the sperm quality?
This is another interesting topic because since we have up to 15% of couples that are not able to obtain a pregnancy in 1 year, we have to do our best to work on sperm quality and to give them more chances to obtain a pregnancy. So there are so many different kinds of procedures that we can apply. But mainly today, the most applied one is the using of the compounds, or in particular antioxidants, that are able to reach better results in the sperm and in all its parameters. Erectile dysfunction is really common and is the most important cause of erectile dysfunction. And this is why it's related to many vascular problems like diabetes and like cardiovascular disease. Erectile dysfunction can be used together with erectile dysfunction to understand and can be used as a predictive markers because usually it anticipates over several months the incidence of diabetes and cardiovascular disease. Lifestyle changes and comorbidities prevention can be used as the first approach to erectile dysfunction and is of vital importance. In our institution at the Department of Urology of Sapienza Rome University, we are using together with lifestyle changes and with the comorbidities treatment the use of a compound that is made of arginine together with the propionyl Lcarnitine to better treat this erectile dysfunction and to take care about the endothelial dysfunction. Even in several cases where you have to prescribe the PDE5 inhibitors, you can add the compound because it can allow to the PDE5 inhibitors to work better, and even because you can have a better release of the nitric oxide because everybody knows that the nitric oxide is the strongest vasodilator that we have in the body.
Can you enlighten us about the metabolic approach and how it improves the sperm quality?
This is exactly what I was talking about. So we are using a metabolic approach because we are acting in general on the metabolism of the person. Because as I told you before, the sperm is the mirror of the health of the person. So if you act on the metabolism of the person, you will reach a better quality of the sperm, but not only on the sperm, even on the health of the person. And health, good sperm.
Does oxidative stress has any role in it?
The oxidative stress is something really important because it's the target of our products, of our compounds. Because if we reduce the oxidative stress, we will have less damages to the cells and we will have for sure better quality of sperm.
What is your experience regarding the use of Lcarnitine and acetyl Lcarnitine in sperm quality?
Yes, this is another interesting topic because the compounds can be made with so many components. And for sure, today, after so many years of trials, of papers, of studies, we understood that what is really effective is the carnitines. And in particular, talking about infertility, the ALC, so the acetyl L-carnitine, has the better action. And if associated together with ALC, so with the propionyl L-carnitine, the action is even better.
Based on your own research and own experience, what are the recommendations?
The recommendation is to use L-carnitine every time that you want to improve the quality of your semen, every time that you want to keep a better metabolic system. And in this case is the most important component that together with others can give a very good action.
In short, L-carnitine and acetyl L-carnitine improve the sperm quality. Does this combination improve the sperm count as well?
Yeah, exactly. We have an experience, a really recent experience in our university. It's a trial that we started in 2013, but it's concluded just 1 year ago. And we took more than 100 patients. We divided this population in people suffering from varicocele and people not suffering from varicocele. We gave to them 3 months of this therapy. And after these 3 months, we gave them other 3 months. So in total, the therapy is 6 months. And the results are really impressive because in particular in patients suffering with varicocele. So varicocele means more oxidative stress. The results are really interesting. And there is really a difference that is statistically significant between people uptaking the placebo and people uptaking the compound.
What about the safety of L-carnitine and acetyl L-carnitine in short-term and long-term usage?
After our experience in our trial and even taking in account the other trials of other researchers, I can say for sure that is something really safe, something that doesn't create any side effects. And in our experience with more than 100 patients, we didn't report any side effects, and it was safe even in association with other treatments that patients were uptaking.